Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. Hello. We're recording on April 10th, 2025. Heads up, Health Affairs released a theme issue on food, nutrition, and health recently. I hope you are enjoying the special series from my colleagues, Ellen Bayer and Jessica Bylander. The last podcast episode on that 4-part series will be published next Wednesday. On April 29th, we have a related Lunch and Learn event for the theme issue. It's a conversation with Marian Nessel discussing the evolution of U.S. food and nutrition policy. Check the show notes to join this free virtual event. Also, our next Insider event is April 23rd with Brady Post on site-neutral payments, and we're working on some events that we'll be able to announce pretty shortly. Today, I'm joined by David Simon. David is an associate professor of economics at the University of Connecticut, and he is the author of the Health Affairs Insider newsletter, Economic Intersections. In this exclusive premium newsletter that you can only get when you sign up for Health Affairs Insider, David explores the intersection of economics and healthcare. And with that spirit in mind, today we are going to talk about tariffs. David, welcome to the program.
Hi, thanks, Jeff. Thanks for having me on.
Just real quick, where are you in the NCAA tournament? Are we done with that? Let's do a sports recap. Did you all win?
I think we won. I'm not a sports person, so yeah, go Huskies. I believe we had our big win and yeah, won the national.
To the task at hand. Thanks for joining Sportscast for a second there. On April 2nd, the Trump administration unveiled a plan for reciprocal tariffs. So we like to think that every episode could be someone's first episode with this. Maybe they're steeped in health policy, maybe they're not. So for those that might be unaware, simply just going way back, what is a tariff?
Yeah, all a tariff is a special type of tax. It's a tax on an imported good. So who's ever exporting that good from that country would have to pay that tax. So what we think of the actual incidence of the tax, whether it gets passed through prices or not, is less clear. So we've probably heard the word tariff a lot in the news recently. From your perspective, what's the big news from this? They called it Liberation Day. Is that right? Yeah. So I think there were a couple of things that, with all of the buildup, that really jumped out on that day. And so the first one was how the tariff was applied across countries. So first of all, it was just more widespread and larger than anyone expected, at least until the recent turnaround. And then associated with that, it is when we think about this, it seemed like the administration was taxing based on the amount of the trade deficit. Which is not, in fact, a reciprocal to the tariffs or even to the non-tariff trade barriers that the other countries were applying, but it had more to do with who we tended to run a deficit with. And I don't think that was expected, and that's not typically how we think about trade policy, and that was probably the biggest surprise. I would think the other major big thing to come out of this was how the bond markets ended up reacting, where we had a sell-off of bonds, and that was probably an unexpected consequence of this as well that I think ended up being quite important. So those were the two big ones.
Yeah. And so you alluded to this. Again, we're recording on April 10th. So markets did drop in reaction, but you mentioned a comeback. So can you give us an overlay of just what's happened so far in the markets?
Yesterday, was it yesterday? Yes, it was just yesterday. President Trump announced a change to the tariff policy, which was originally this sort of wide-based, deficit-based tax, and he reduced it to a 10% tax on all countries except for the China, I think, was the main one who he saw as having responded with their own tariffs, which now has a quite high tax. And that was it. So I think that's now at 120% or around there. At first, we saw a relief in the markets because I think it was so broad-based that in of itself seemed to have a lot of disruptions. But then, and so there was a spike up, though now the market seemed to be trended back down. I think as they start to price in what the effect of these tariffs could be, how it might affect growth, because the tariffs are even with the pullback tariffs are quite high still, especially on China. They're well above anything we've seen in recent history.
Yeah, so I don't want to start making predictions about what's going to happen because we probably don't really know what's going to happen, and by the time this episode is released tomorrow, information may have changed drastically. So, but based on that, as a concept, how do tariffs affect costs and prices to both business and consumers in the U.S.?
Yeah, that's a great question. So conceptually, we think of tariffs, as I mentioned, was a tax. And so one of the key things that we care about the tax would be what economists call the incidence of the tax. And that's essentially which side of the market pays the tax. So in the case of tariffs, that would be two people effectively have to pay for the tax. It's either those who are buying, which would be the U.S. in this case, or those who are producing the goods and selling it, which would be China or another country who implemented that tariff. And if you look at the recent sort of research on China and previous tariffs that have been levied recently by the U.S., as well as just sort of the general sort of what we see with tariffs in general, that it seems like most of that gets passed on to the country that's purchasing the good. And so about 100% pass through. So most of the tax gets passed through. Now, it gets a little bit more complicated in that once you have that, then the U.S. companies who are purchasing the goods can choose to either choose to pay the tax. And so this would maybe like a hospital who's importing a medical device. They can eat it out of their profits, or they can cut back production, or they can pass down the full amount of the tax or some amount of the tax onto the consumers, or in this case, people who are using hospital services in that example.
So, can you give me an example of what we've seen in the past, or like how might that play out?
Yeah, absolutely. So the best research we have on this recently I think it's a 2023 paper that looked at how tariffs from the first Trump administration, where he implemented a number of tariffs on China, how those ended up affecting the prices and who paid them. I think like I sort of alluded to, almost 100% of the tariffs got passed on to U.S. companies. And then the question becomes how those companies responded. So depending on the industry, some of that money got passed on directly to consumers. In some cases, a lot of it. In other cases, the companies paid it, and they can end up either eating that out of their profits, or possibly, and what we would think in the longer term, that would be cutting back production, maybe producing less, firing workers, and that kind of thing.
Looking back at that research, I want to ask about the healthcare industry portion of it. So, was there any information about how healthcare companies responded?
They didn't specifically look at healthcare. They did look at electronics, which is probably close to what would matter for medical devices. I should say the other big one from China would be pharmaceuticals, but those have so far been exempt from tariffs, even the recent ones. But if you look at electronic devices, most of that did not get passed through to consumers, but got eaten by the producers. And again, I don't think we know yet exactly how they responded, whether that was just purely out of profits, or what you might think more of is that's going to, they're not going to expand as much, or they might have to do layoffs or something like that. They have to cut costs somewhere else. That's their option, right? You either to consumers, you eat it out of profits, or you cut costs somewhere else.
Well, as reported by Axios, medical device makers and hospitals were pressing to gain exemptions from the recently announced tariffs. It looks like this did not happen. So looking at the healthcare focus and given what you just said, generally, how may tariffs as a concept affect healthcare?
So I think, as you're saying, the big thing here are the prices. And those prices, we think in the long run, at least over time, will be passed down to consumers. And I think a key thing to remember here is that even if companies shift to purchasing from U.S. or from places with a lower tariff, importing goods from there, or doing U.S. manufactured goods, the prices still go up. And that's because these other companies, they have more demand on them and limited supply, limited resources to provide, and that's going to push up the prices of the domestic produced goods as well. The other thing to really think about that I think there's concerned are is that when you think about pharmaceuticals, or especially with medical device manufacturing, these have extremely complicated supply chains. I don't think we even necessarily fully understand how complicated these supply chains are. And some of these inputs are done on very low profit margins. So some of these supply chain providers who are making an input into the device, which is also imported, and might be 2 or 3 steps down up on supply from where the device is manufactured. The concern is that they could be pushed out of business. Their profit margins can be very low, and it can be sometimes the case is there's just 1 or 2 of these manufacturers who are making these devices, and that can really end up causing in the healthcare sector and other sectors as well sharp limitations on supply backup. It can disrupt the supply chain, similar to what. There's a great article by Ben Golub, who's a network economist, who talks more about this, and he said at the extreme end, it could be as bad as the COVID disruptions or even more. So if you think about some of the problems that the healthcare industry had in COVID, if these tariffs end up being long lasting and if they end up being large, then you could really put under some producers and have supply chains start to back up. So
yeah, that seems to me like that would be a very, very extreme case, though.
Yeah, I think yes. I think the issue is that these global markets have been so integrated and are so complex that no one really knows. I mean, I think
sure.
that someone's steering this, or that someone is not the case. So I think like a car manufacturer like Toyota or something, if they look at the number of inputs that they're bringing in from other places, you're talking about a couple 100,000 different inputs from different places. So that's I was saying that I think that's what part of what markets are reacting to is how uncertain this is. Yep.
Yeah. Because when you think about like from a hospital perspective, there's so many potential medical devices, from X-ray machines to CT scans to stethoscope is a medical device, but not exactly what we're talking about here. But those kind of things when you're talking about supply chain, there's like big ticket devices or pieces of equipment items, as well as just like your day-to-day, like Band-Aids, cotton swabs. So a lot of potential to be seen about like how this actually would shake out in a provider setting. As we wrap up, how could, and we kind of touched on this already, but how could healthcare spending and utilization change in the face of these economic changes? And what might you say is I'll just stop it there, in the face of these economic changes?
Yeah, I mean, I think the thing to realize is that this is done to reshore, and it's going to be really slow and expensive to reshore some of these producing these items that like these medical devices. That's if it's even possible. It might be that these global supplies are just too integrated at this point. And so you basically, there's 2 things that can happen. You have, and I think it is what we've talked about. Prices go up and that ends up increasing costs, or there's shortages in the meantime, in the intervening time.
Do you think this is like something that insurers want to take note of before patients, or patients before insurers? Do you have any insights onto that?
Yeah, I mean, if it's a shortage, I don't know if the insurer, then in that case, that kind of tempers down demand in a way that doesn't affect the consumers. But to the degree that this is just upping prices, yeah, I mean, this is going to be out of the pockets of insurers. And so if I were them, they need to start pricing this in.
I mean, it will be interesting to continue the tracking of research on healthcare spending and utilization going forward. David Simon, is there anything we didn't talk about that, if you were in my shoes, that I should have asked you, while we have you?
Let's see here. I think we got the major points that I, wanted to cover. Yeah, I think the last thing to know is that this is just really unprecedented waters, both in terms of the extent of the tariffs and how they're being done. And that's what you're really seeing markets react to, is that we don't know. We know it's going to hurt, but we don't really know how bad.
Well, may you live in interesting times.
I like times.
David Simon, thank you for joining us on Health Affairs this week. If you, the listener, enjoyed David's insights and want to hear more from him, please sign up for Health Affairs Insider, where he writes our Economic Intersections newsletter. And if you enjoyed this free episode, pass it on to a friend, maybe the day trader in your life, and we will see you next week. Thanks all.